Hi, Mr. Ralph. My name's Cy. I'm a nursing student, and I'm going to do your assessment today. I'm going to wash my hands because I have good hand hygiene. When I get done, I'll check Mr. Ralph for any immediate life threats. He doesn't appear to have any. I will assess his alertness. He's able to follow me around the room and pay attention to what is going on. I'll check his orientation for person, place, time, and event. He's able to answer all those questions. While he's answering the questions, I'll look at his facial expression and his speech to make sure he answered them in no slurred speech and they were incomplete sentences. I'll check Ralph's hair for that he actually has hair, any lesions, drainage, abnormalities of the head. He doesn't have any. I'll check his eyes. They're symmetrical, no edema, no discoloration, no glasses. Check his ears. They're also symmetrical with no drainage, no hearing devices, no lesions. Check his nose, no excessive drainage there. It's midline symmetrical. Look in his mouth, hard and soft palate, no excessive oral mucosa, no dentures noted in there, and no gingiva. Gums appear to be a good color. Check his trachea. His trachea is midline. Check his carotid pulse on this side. Check his carotid pulse on this side. Move to his chest. No accessory muscle use in his chest. Listen to his lungs. Listen to his actual heartbeat for a minute. Minutes up. We'll sit him up. Listen to his posterior lung sounds. Sit him back nice and gently. Ask him if he's had any cough, excessive sputum, or dyspnea. Oh, what is dyspnea, you asked, Mr. Ralph? That's shortness of breath. Are you having any of that? No? Perfect. Okay. So, we'll check Mr. Ralph's arms here. His range of motion, his movements. Those are good. On that side. Check it on this side. Check his brachial pulses on both sides. His radial pulses on both sides. His capillary refill on both sides. Perfect. Check his abdomen. Doesn't look like he has any obvious distension. Listen for bowel sounds. Palpate. No guarding, no rebound, no referred, no in general tenderness. Are you having any constipation, diarrhea, urinary incontinence, nausea or vomiting? How's your appetite? Perfect. No urinary catheters. Check his lower extremities. Everything seems to move well on this side. Check for Hohmann's sign. Do you have any pain when I do that? No? Excellent. Check this side. Check for Hohmann's sign. Any pain when I do that? No? Perfect. Rotate his ankles around. Check for femoral pulses, popliteal pulses, posterior tibial pulses, dorsalis pedis pulses. Those check out good. While I was doing his assessment, I checked his overall skin for breakdown rashes or anything like that. He has no tubings, IV tubings, O2, NG, or feeding tubes. Ask Mr. Ralph, do you have any questions that I can answer for you? No? Good. Put his bed in the lowest position, put the handrails up, lock the bed into position, put the call bell there, move his table over to him. Mr. Ralph, I forgot to ask you, are you in any pain or discomfort anywhere? No? Perfect. Okay. If you need anything, ring your call bell, and I'll come back in and check on you. Wash my hands, and I'm on my way out the door.